Begin with you, Deborah. Identifying yourself, we go down the list and then I'll begin the questioning for a change.
I'm Deborah Garvie and I'm Policy Manager at Shelter.
Rabindrakumar, Head of Policy and Research at the Trussell Trust.
Morning, I'm Peter Tutton, Head of Policy at StepChange Debt Charity.
Very good. General question to all of you. We're looking at how best to measure poverty. Do you think we can settle on a single one? Or should it be a number? And what role now should the Social Metric Commission's proposals play in our deliberations, please? Who'd like to begin? Deborah?
We certainly support a single measure of poverty. There's currently no clear definition. And what that means is there's no sort of consistent frame of reference for debates, and energy's wasted sort of debating whether the definitions are appropriate or not. We think what's much more important is getting on and looking at the solutions and spending energy on that. So in terms of the Social Metric Commission's proposal, we've had a look at that and we welcome it. We think that it should be taken up. Do you think that should be
the single measure now?
Yes,
all right,
we'd be in
really
support.
Good. Thank you. Come in.
Certainly at the Trussell Trust we've found the previous suite of measures around measuring poverty quite useful. They're no longer official stats anymore, obviously, and we echo what's been said around the Social Metric Commission measure. We think that that's quite a robust approach, and in particular for the Trussell Trust, understanding those inescapable costs of living, so particularly for families with children, like childcare costs, for people with disabilities. They're the people who are overrepresented at food banks, so it makes sense that we are measuring those more accurately.
Very good. Peter?
Similar, quite like Social Metrics Commission saying, in particular the inescapable costs. So they propose things like unsecured debt commitments. And looking at our clients, we did a sort of rough assessment. 41% of our clients poverty, but if you take on their debt commitments they would have to pay, that would put that number up to 75%, so that's money not available to people. So we think that that's very good, looking at those inescapable costs. In terms of one measure or many, I think a central measure is a good one. The suite of measures before had value. The Scottish Government seemed to have retained that. And finally there's something about, as well as measuring poverty in the sort of broader thing, what sort of measures might be useful in terms of vulnerability to poverty. So we're a debt charity where people are hovering just above, or anything happens to them, a shock, and they're pitched into trouble. We don't really have good measures to understand financial resilience or financial vulnerability, people who are just above, which would be useful for policy.
Do you not think we should try to get an agreement on a single definition first?
Well, I think that's right. First thing is to get an agreement and on that single central definition, and then think about the things around it. I mean, the Social Metrics Commission talk about depth and persistence and things, so it's about them thinking about stuff around it.
Right. And do you think we should have a definition of destitution? Stay with you, Peter.
I think it's useful, and JRF have done some work on destitution, and certainly what we see with our clients is people who struggle with just the basic essentials. That's quite useful to have a definition of destitution. It raises a different sort of set of policy questions. So when we see the proportion of our clients, there's about 40% that even after budgeting counselling can't afford to pay their fuel bills or their rent or their ongoing food, it raises a different sort of set of questions. So whether that's how you do that different from depth of poverty, the idea of having a measure which looks at particular things, can you access, can you afford essentials, would be quite useful. It would focus policy on that group that are the most vulnerable.
Could tie in with your other point, couldn't it? What do we look out for people who are going to be kicked down to the very bottom?
Exactly.
Yeah. Sumi?
We'd agree that it's quite valuable to look at destitution, not as a replacement for looking at poverty, but just as an additional factor. I think in particular the chronic nature of deprivation. It's something that at the Trussell Trust we are talking about more internally, about chronic hunger and whether people are forced to use food banks for longer periods of time than we would have expected in the past. So that sort of depth of poverty measure, persistence of poverty, is quite an important one.
When you say longer period of time, because it's really 3 helps, isn't it? And that's the end. That traditionally was your policy. Are you saying the pressure now is such that you're changing it?
So it's not, the 3 parcels policy isn't fixed in stone. Obviously, if people come to our food banks and they've been referred, then people will be helped and supported. But there are rumblings, and a few food banks have talked about sort of increasing numbers of people who've been referred multiple times, more than the typical 3 times within sort of a few months. And that's something that we
data on that, the numbers?
Well, so exactly. So that's a piece of work that we will look at internally about whether we can put any numbers to that, whether it is a real change or not, or whether it's sort of anecdotal and more disparate. But what's important is that the Trussell Trust network is obviously not all of emergency food provision. We can only capture a small part of the problem, which is why...
my question, actually, Sumi, whether it, and always have to remind ourselves that you're not statisticians, you're food banks, you know,
exactly.
You're not there to do everything. But if you were able to capture how many times they've come to you, perhaps another question could be, and have you been somewhere else as well? You know, to like a lower level.
Yeah.
So exactly, so that can capture some of that sort of broader support or other avenues that people are forced to use. I think there's a value in sort of a central measurement system so that it's not just reliant on the volunteer-run network.
But you do keep data, don't you? Numbers that come only once or come twice or 3 times, because I've seen the data. This would be more than 3, wouldn't it?
Exactly. So more than 3, we can look at whether there are the flags for whether there are more than 3 parcels. We know that there are caveats with that data. It's not always recorded consistently, which is why we're quite clear that this is something that needs to be done centrally as a sort of statutory measure.
We might follow up with you afterwards on that, if we may. Ruth?
Thank you. I was just going to say, in my local area, then they have food clubs where you pay £1.50 a week, and then every week you get food that's been donated, whatever has been given. Does the Trussell Trust run anything like that, or is it simply emergency food parcels?
So some food banks in our network do run other forms of support as well. So they could take part in community cafes. They might sort of have an equivalent of a social supermarket or something similar to that, or at least be involved with local other providers who are sort of running similar things in the local area. But the sort of first and foremost, we're about emergency food provision, but certainly there are examples of that sort of wider support in the network.
Deborah?
Just to go back to the Social Metric Commission as well, the reason that we support it is because it's an after-housing cost measure of poverty, and we think that's absolutely vital. It also includes people who are rough sleeping. It counts those as being in poverty, and it's really important that we measure after-housing costs in order to see how much housing costs are pushing people into poverty. In terms of destitution, we support the Joseph Rowntree Foundation definition. Destitution is distinct because it means you can't even afford the absolute bare essentials, and that would be on an ongoing basis. So, you know, we're regularly now seeing parents who are going without food in order for their children to eat, and sitting all evening, you know, in the dark because they can't afford to have the lights on. So it would include that kind of thing, very basic need.
Thank you. Heidi?
Thank you. So I'd like to tease out of you all your views on what is the crunch thing? What's the thing we need to fix? If you were the Chancellor and you had a choice of where to spend your money, and whirling around my head is benefit freeze, how the local housing...
I'm trying to lead you in the answer.
Yeah, sorry. Okay. In my head. Tell me if my head's wrong. Okay, stop it, Heidi. For example, the benefit freeze, I don't believe, and commentators have suggested, that we need to dump that last year. We're just spending reviews coming up. We need to just get rid of that instantly. I'm interested in how you think the local housing allowance kind of is in the mix of this, people's affordability of houses. Just building on your point, Deborah, just then about, you please, this metric is after housing costs. Mm-hmm. And it's not actually on the questions, but why not universal credit 5-week wait? So I'd just be kind of interested in your views. Or is there something else that we're missing? They're the 3 things that I suppose occur to me as the big ticket items. And perhaps start with Deborah and your thoughts.
All right, are there other than those 3 issues the Chancellor should concede on? Deborah?
Well, certainly housing benefit is the most important way that you can prevent homelessness. And so local housing allowance, which is housing benefit for people who are renting privately, our analysis shows now that if you're looking for a modest 2-bedroom home, then in 95% of areas that's not affordable to you on local housing allowance. So it's become an absolute crisis.
So it's no longer just like London and Cambridge where I live, expensive places?
Absolutely not. Apart from a few areas, Cumbria and places like that, it's pretty much the whole country. And it's no doubt causing homelessness. It's pushing families who are wanting to self-serve, are wanting to compete in the market and find their own private rental. It's pushing them into homelessness and very, very expensive and absolutely atrocious quality temporary accommodation. So it's pushing people onto the state at much greater cost, both to the households and to local authorities who have to accommodate them. So we absolutely want to see the freeze ended as it's due to end in 2020, but it's absolutely vital that the rates go back up to the 30th percentile at the very least, which is government policy, because they've fallen far below that in many, many areas. So, for example, in Hackney, where we have a hub service, there are now 3% of rentals in Hackney are available to local housing allowance claimants.
Have you got some stats across the country that you could share with us to show that gap of reality versus what the allowance is?
Yes, absolutely.
Perhaps that might be useful for us, just to illustrate the point.
Yeah.
Very good.
So for you with the housing, I guess from your point of view with the housing. Yeah. Sumi?
I think one of the sort of big drivers, certainly that we see from our data from food bank referrals, is that low income is a big reason why people come. So there's a fundamental issue around the adequacy of the safety net. I think with that in mind, although there are lots of things obviously we would want improved, there are sort of three standout items. One is the benefit freeze, because that is about basically the safety net keeping up with the cost of living. Particularly when low-income families have already been hit hard by cuts, with Brexit on the horizon and the consensus around possible inflation. It makes it even more imperative that that's lifted for the last year of that freeze. Touching on the local housing allowance, there was some research that we commissioned from Oxford University, and in terms of the proportion of people who were struggling with rising living costs, I think around 28% of that was around rising rents, and it showed that private sector tenants were struggling more than the social sector. So there is that issue around local housing allowance that we certainly see. The second issue, as you touched on, is universal credit. Again, there are lots of issues there, but for us the priority is that 5-week wait. There's a danger that it sets people up to fail in terms of their financial security. We've obviously launched a campaign on this recently. We think that there are sort of tangible ways in which you could solve that problem and make sure that people get money sooner. And that would be
and money that they don't have to repay.
Exactly.
Presume, so not the advance loan payment isn't the answer.
Exactly. The current solutions aren't really a solution. It loads debt onto low-income families, which just isn't the right way forward. The third thing that I just wanted to flag was around local welfare assistance schemes. We've seen that those have been really depleted in many areas. It means that crisis support, the emergency kind of stopgap that was supposed to be available for people.
So would that be local authority driven?
So they are run by local authorities. That was devolved after the social fund was devolved, but the central funding has sort of disappeared in some cases, in terms of there's no sort of targeted ring-fenced funding that comes from central government for local government to then disperse. So the Scottish Government is a good example in terms of comparison. They have a Scottish Welfare Fund, which then can be drawn down. So there are sort of examples that exist in the UK to learn from, we think, in terms of running that much more effectively.
And that was something Frank and I saw in Morecambe last week. It was as much talk of, well, the local authority can't do anything anymore. It was very much, there were no local fixes, the money's just gone.
And just to add, the real concern that we have in terms of food banks is that food banks are now seen in some areas as the first port of call. Yeah. It's normalising a form of support that shouldn't be seen as the mainstream, and that's
Absolutely.
a really worrying trend.
Yeah. Peter?
I mean, much the same for our clients. What we know about debt is small margins make a massive difference. If we can get people so they've got a bit of budget surplus and they can pay their ongoing bills and maybe do something about their debts. So in that context, a few pounds either way can make a huge difference. So we estimate that benefit free is currently costing about £33 a month for our clients in reductions. So these are people with not much, so it's very significant. Likewise, local housing allowance, about 90% of our clients who are in private rented sector it's not meeting they're having to top their rent up through their benefits. And when you think that about a third of our clients in private rented centre are people who have might call other vulnerabilities, things like mental health problems, physical health problems. So you've got a highly vulnerable, poor, likely to be more persistent poverty, struggling to meet their basic essentials. And that problem seems to be growing. We're seeing more of it, not less. So agree with that. And I agree on the sort of access to emergency cash point with local welfare not really working in terms of there's something like 3 million people using high-cost credit to meet essentials like rent and fuel and food and things like that. So the Treasury in the budget announced a pilot for looking at kind of a no-interest loan scheme to better support people on low incomes. So there's something important there that the Chancellor could do to see how we could better support people who have needs for emergency expenditure, which doesn't mean going to high-cost credit. We might come to government debt would be another thing about how the government acts to credit. We'll come to that in a minute.
Yeah, that's later on. Actually, just one thing I forgot to ask. On the housing benefit, however you want to call it, not matching reality, discretionary housing payments within local authorities, do they fill that gap? I mean, there should just be a temporary 1 or 2 off. They shouldn't be a constant each month by month. Do they do anything, Deborah?
Well, obviously they're helpful if you can achieve them, but they're trying to plug shortfalls in so many areas. You know, they're plugging shortfalls with bedroom tax, they're trying to plug shortfalls with local housing allowance, and then the benefit capped households as well, who, you know, large numbers now, you know, over a third benefit capped households now sort of destitute, they're going without basic essentials. So, you know, they have to stretch so far, and in our experience, it's usually only a sort of short-term offer, so they might give you kind of 3 or 6 months, so it's not something you can rely on, you know, to make up shortfalls. The other thing I'd add is back to local housing allowance. The shortfalls, you know, are not something you can budget around. So in 25% of areas, people in need of a 2-bedroom home, the shortfall's over £100 a month. So it's not a matter of shaving a couple of pound off, you know, your shopping bill or something like that. And this is month after month after month. And, you know, obviously it's people in work. I mean, it's over a third of local housing allowance claimants are in work. They're already working. So we're now seeing, you know, 55% of homeless families are in work. It's people are homeless and they're getting themselves to work every day.
Very good.
Thank you.
Nigel?
We just touched on, I guess, the approach to recovering debt. Perhaps, Mr. Tutton, you could make any suggestions for how you think the department should change its approach to recovering debt. I mean, I think you probably suggested that we shouldn't put people in debt at the start of their UC journey. Was there anything else you would like to see them change on that, perhaps on the rate of recovery?
So there's a range of different things that both DWP and government generally can do. So, I mean, you're right, and colleagues will talk as well about the sort of wait at the beginning of UC. If people have to wait weeks and weeks before they get some money, it's going to put them into debt. It's not going to be sustainable. And certainly when people are ringing us up, very often we're referring people to Trust because they have no money and the wait is a real problem. Once people get their benefits, some specific problems, so deductions from benefits for things like debt recovery or repaying advances or sort of budgeting loans. We found that when we asked our clients, about 71% of them said that deductions from benefits had caused hardship. So we're in a place at the moment that it was welcome that the kind of maximum was reduced from 40 to 30, but even so the department isn't working on a kind of affordability basis. Elsewhere in the debt world, it's really important that creditors only take what people can afford. So we would like the department to sort of move much more towards an affordability framework. So a reduced maximum is good, but that's still going to leave people a lot of 30, for our clients 30% is a huge amount to swallow and it will put them into hardship. So there's more that needs to be done there. There's at the moment Treasury have just finished consulting on schemes to support people with multiple debts, breathing space and statutory debt management plans, which will be really significant in helping people. We need government to commit. We think government debt will be in, but it needs, I think DWP debts need to be in there as well, and there needs to be a facility to stop third-party deductions where that is unaffordable. More generally, across government, there are some fairness principles being developed. They have to sort of land and become effective. So this is about ensuring that the way that you deal with debt doesn't make debt problems worse, takes account of vulnerability and takes account of affordability. They're excellent principles that the government wants to roll out. Finally, I mean, it's worth saying a bit about bailiffs. The Ministry of Justice are consulting on bailiffs at the moment, which is something that local authorities send out to over 2 million bailiff warrants a year, and particularly with reference to council tax supports, which obviously council tax benefit. Council tax support is less generous. It's effectively a tax rise for people who are highly vulnerable. IFS reported the other day that people are just unable to pay the council tax liability as a result in that effective rise in tax. Local authorities may respond by issuing bailiffs. So what you've got is people are highly vulnerable, being asked to pay a liability they can't possibly pay, and then when they can't pay it, they're subjected to an extremely intrusive and expensive form of enforcement. It is quite extraordinary that we've got there. So there's a range of things that both the department, the DWP, but other government departments can do to relieve the pressure on some of the most lowest income households.
I suppose the first thing is not overpaying people in the first place. We don't have to recover any money people shouldn't have had. That would be a good start, wouldn't it? I mean, do you accept that at some point there has to be, I suppose, to have confidence in the system? You know, if people have had money they shouldn't have had, there needs to be some way of trying to get it back. It's a balance of how long a period you take and how big a proportion that you take each month. I mean, that's the balance we're trying to strike here.
Absolutely. I mean, it's all about this point about affordability. If you, going back to the point about the social metric commissions, if you look at our clients, you take the debt repayments, it doubles the poverty rate. So if you are taking amounts of out of people's benefit that are going to massively increase their hardship, it's counterproductive. So what they will do is they will start borrowing, or they will juggle their bills and fall behind on other things, and that cycle of disadvantage just continues. Yeah.
Anything?
Well, just to add that, as I've already said, because of the shortfalls in local housing allowance, people are now routinely having to dip into their subsistence benefits to make up the shortfall, and those are very large shortfalls. So then if you're trying to then claw back, rent arrears, debt and other forms of debt and overpayment of, universal credit on top of that, you get to the point where there's nothing left.
Do you have anything new to add?
I think we definitely agree in terms of looking at affordability as a starting point for deductions. I think just as a sort of taking a step back, I think there's just an important question about what role government policy plays in terms of creating debt in the first place. So going back to the issue around the 5-week wait, around council tax support, around sanctions, for example, those are all government policies which the government has some kind of leverage over to make sure that they aren't creating debt in the first place for low-income families.
All right. Ruth?
Okay, thank you. Given all that you've just said and the very specific problems for people that add up to affect so many people who are on benefit, do we still have a functioning safety net?
We would say no. If you think of basic needs, perhaps if you think of Maslow's hierarchy of needs, the most basic need of all is having somewhere to live. And increasingly, as I've said, we've got families in work now being pushed into temporary accommodation, and councils really struggling to find affordable housing for them as well. So, and then on top of that, obviously, struggling then to afford to pay for basics, so in a state of destitution. So, no, we would say that it's failing people very much at the moment, and that it does certainly need addressing.
I think from our perspective, in terms of what a functioning safety net is, a system that's fair and compassionate, we would agree with the Secretary of State with that. A system that gives people enough income to stay afloat, that treats people with dignity. I think on those principles, I think we're still quite far from having a functioning safety net, particularly for specific groups. Deborah's covered a lot of it, but for specific groups, from their perspective, it's definitely not a functioning safety net. So people with disability, single parents, those groups have been really hard hit by cuts, successive cuts over a number of years. I think from their perspective on what the safety net provides, it's far from functioning.
Yeah, I mean, it's worth starting by saying that for our clients, kind of the safety net is unbelievably important. About 60% of our clients, maybe a bit little more, are coming to see us because they've suffered some major shock to their income. So the fact that there is some sort of safety net, if it wasn't there, if benefits weren't there, they'd be doomed. However, of those clients who are receiving credits or benefits, 41% have got a deficit budget. So it's almost half the benefit system. The safety net is so close to the ground that they're still a very, very hard fall. And I mean, echo that, we're seeing the number of, say, for instance, single parents. About 23% of our clients are single parents compared to about 9% of households, massively disproportionately represented in debt stats. So this is, it's really struggling. A lot of our clients, about 55% of our clients, are households somewhere in work, which goes to talking about what's the safety net for. So if the safety net is about helping people recover from shocks, telling thing, I think it was in the Social Metrics Commission, is a very small number of people meeting the poverty definition where you've got two adults in work. Less than 2% of our clients meet that definition. But people in low incomes now, you need two people working to make ends meet. Something happens to one or and you fall over. So the safety nets aren't protecting people from that shock. Finally, there's a sort of what are safety nets for? Are they to stop people just falling into destitution, or do we need policy to think more about prevention and financial resilience? So what can public policy be doing to help stop people falling all the way they fall? And that's where there's a big policy gap.
And what do you think that forward-going policies are likely to do as far as we can see? We've got another year of benefit freeze. We've got universal credit being rolled out, albeit with a raised work allowance. Go back the other way, but starting with you, Peter, if there are no changes to what we've got planned at the moment, how's that going to impact?
Well, we're likely to see more of what we've been seeing over the last 6, 7, 8 years. We've seen more of the households coming to us who are struggling with things like council tax. So it's gone from 11% of people with council tax debt to over 30%. We're seeing more people with rent arrears and more people with fuel payments. That will carry on. So if people, particularly where we're seeing more people in insecure jobs, uncertain hours, all that, it all adds together to that sort of the number of households facing almost permanent income insecurity. Some of the change talks about getting rid, taking off the benefits freeze, making universal credit work well and work with the reality of the kind of lives of the people we see who can't go a whole month without income, who constantly have different changes and their incomes are so low that you can't, you are going to get periods in where you are without money. You make those periods very long and people just can't survive them. So there's some immediate things that can be done that can ease the pressure. There are some things going on in terms of safety nets elsewhere. So we're seeing with things like fuel bills, with social tariffs and bits of the safety net sort of coming out of the benefit system and coming into areas of kind of like almost like corporate welfare. Now, how those things link together is another thing that needs to be looked at.
Okay, thank you. Sumi.
I think when the Trussell Trust looks at its own data, in our last cut from April to September last year, there was a 13% rise compared to the previous year before. Our concern is that figure risks continuing to rise unless there's sort of significant mitigations put in place by the government. Universal credit is an opportunity to sort of tackle some of those issues, and it is welcome to see some of the changes that have started to be announced and some of the sort of perhaps this change in tone around universal credit. It's just that needs to be followed up with sort of more concrete action, and also thinking beyond universal credit, so things like the benefit freeze and understanding those other sort of and local welfare, understanding how those other bits of the puzzle sort of fit together. I think that's I think would echo what Peter has said around the issue around financial resilience is a critical one, and I think there's perhaps some rebalancing to do around how we design our policies to look at exactly what people on low incomes really need to have a secure life. It's not enough to sort of be bobbing around on the edge. People need more than that to sort of survive and thrive.
Deborah?
We've seen a 44% rise in families, homeless families. in homeless accommodation in the last 5 years. Obviously, we're very supportive of the government's targets to reduce and eradicate homelessness, but we really fear that they will not be met unless there is a properly functioning safety net. People need to be able to compete in the private rental market, and they're just completely unable to do that at the moment. And it is women and children who are being the most severely hit. The vast majority of families in temporary accommodation are lone mother families. And so I fear we will see it go on. We're very, very pleased with the changes that have been outlined with the rollout of universal credit. But it is the freeze to local housing allowance and some of the other functionality problems, particularly the 5-week wait. Those things absolutely have to be addressed because we're now dealing with people at crisis point, and what we need to do is make sure people don't get to crisis point, and that's what housing benefit is for. We'd also like to see a big increase in the amount of social rented housing, but housing benefit is an absolutely vital part of any kind of safety net to avoid homelessness.
Brilliant. Last question to you, Sumi. Does the Trussell Trust fear that we will run out of food for our food banks, or enough food?
So at the moment there's sort of no change operationally. We have said publicly that in the event of a no-deal Brexit, for example, there are sort of some critical concerns, and we're having discussions internally, operationally, but for the moment there isn't a sort of crisis response or anything like that.
But assume there's no changes, going back to Heidi's questions, no changes, therefore we're going to see more people in desperate conditions. You think you'll be able to meet their needs?
So I think on that basis, we will struggle if it's just continually year-on-year increases in demand. Food banks are already overstretched in terms of their capacity. At the same time, we recognise the generosity of the public in terms of donations. So I think we would struggle if there was a sort of never-ending increase in food bank referrals. I think that can be mitigated. We've seen sort of announcements that would help to already that would help to mitigate that. For example, the work allowance. It's just about keeping up that momentum and tackling some of those big problems, like the 5-week wait, like the benefit freeze.
Great, thank you all very much. Thank you.
Can I just ask about food banks are much more of a challenge in rural areas. We can't assume that they cover everyone who needs them. Are there particular groups, particularly in rural areas, that will be falling through the gap?
So I think rural poverty is a concern, and we certainly recognise that. Food banks can't cover full geographic spread. So in terms of access to support, there are groups like that who will be sort of worse served.
Can we write to you about that, whether in fact you think there are areas of the country which food banks still don't reach?
Yeah, certainly. I think obviously we can comment on our own network. There's independent networks as well which will cover sort of some of the gaps.
And then we'll match it with what Ruth's got from her constituency. All right, great. Thank you very much.
Some of our food.
Great, welcome. Sheila, might you introduce yourself?
Sheila McKandie, Benefits and Welfare Manager at the Highland Council.
Can you speak up, or can the mic be louder, please?
Apologies. Would you like me to repeat?
Yes, come on, Sheila. Say who you are.
Sheila McKandie, Benefits and Welfare Manager at the Highland Council.
Councillor Veronica Dunn, Newcastle City Council, and I'm Cabinet Member for Resources.
Bring Chris.
Yeah, thank you. Veronica, if I can start with yourself, obviously Newcastle had taken the voluntary decision to adopt the socio-economic duty, meaning that the council was required to take into account the effects of its policy on socio-economic disadvantage. So it's just to ask you how that has influenced the way Newcastle makes its decisions on local support and respect of welfare.
It's a really interesting exercise for us. I don't know whether the committee is aware, but the Labour administration took over the administration of the council in 2011. So one of the first things we did as a council was, even though it wasn't a statutory thing as part of the Equalities Act, we did decide to adopt a policy of socio-economic duty, because we thought it would be a catalyst for change in the way that the council operated, the way the council thought, the way the council prioritised its services. I mean, it's a huge thing. It can improve people's life chances, how they get on at school, go into further education or training, their employment prospects and their health. So it was worth doing for us. I suppose one of the first things we did was to establish a fairness commission. Now, I don't know whether you've heard of that, but there's a report of the outcome of the fairness in the commission in the city, broadly endorsed by all of the partners that we work with across the city, whether they're anchor institutions, other public sector bodies, residents, business in the city, broadly accepted as a good model and something that they wished to support. And if I can point to 4 specific outcomes from that Fairness Commission, it said what should guide our decision making was fair play, fair share, fair go and fair say. And that's at the root of kind of the lens through which we look to everything we do. I suppose what I'm looking for today is to give some idea of the way in which Newcastle operates, so that it can contribute to our shared understanding of the issues and the absolute need for a welfare safety net and the impact that that does have on people's lives. Just listening to some of the earlier contributions, I didn't hear them all, unfortunately, but I did hear a question about is the safety net still important? It's absolutely vital. We see it on a daily basis. I'm not a policy advisor to the council. I'm a local councillor. I believe, in fact, Heidi and the chair are due to come to my ward at some point in the future. You're coming to Biker, which is the ward I represent, which is a very deprived ward, one of the most economically deprived wards in the city. So we pay special attention to that ward. And what we've been trying to do through our conversations that we have across the city, involving people, all of the organisations I mentioned earlier, I don't need to repeat them to you, to say to them, for example, at budget time, we're in the middle of setting our budget for next year. So we talk to people about what our budget proposals are. We consult for a lengthy period with all of those organisations. We produce what we call, I think it's a fairly common term, integrated impact assessments. So we look at the impact of our proposals through that lens of the Fairness Commission, the fair say, fair go, fair share. And we look at the impact of those proposals, and then we put all of the different proposals together and the individual impact assessments and produce a cumulative impact assessment. So we've got an evidence base that shows us or that we can use to tell us what the impact of our decisions is going to be.
And that would be an economic impact. It would be
whether people with protected characteristics covered by the Equality Act, the impact on the city economically, the impact on our income, the impact on the services that we deliver. So we look at all of that through the lens of saying we want people's lives to be better, not worse.
And are you, Veronica, then, when the council's doing that exercise, is it looking at some of the things that's happening elsewhere? For example, Scotland take a different position, a different view on a lot of this. Are you looking at what's happening in Scotland? You're looking at what's happening elsewhere, maybe as a model and a guide in terms of the engagement you're having with the community?
Oh, I mean, there's best practice to be observed wherever you can. And certainly our officers are very, very conscious of the fact that Scotland did adopt the social economic duty and look at some of the strategies, I hate the word strategies, plans, policies, to ways of working that can be applied in other places. And we have those conversations and we try and apply them wherever we can, given the reduced resources that we've got. I mean, it's a very difficult financial situation that local councils find themselves in. I'm sure Sheila probably finds that particularly so in her role. I think what we try to do is learn from that best practice, see what we can do, but because inevitably demand is increasing all the time and we have to protect our statutory services, children's, adults, and we've seen a massive increase in the demand for those services and in their costs. I mean, committee will be well aware that councils have had the ability over the last few years to apply a social care precept. But that's simply increased people's, the amount of money they have to pay out on top of their council tax, for example. And that's something that the council can't stop. We can't do anything about it. We need that money in order to continue delivering those services. But there's a cliff edge is going to appear there. Certainly in Newcastle's case, we know that when the Better Care Fund, the improved Better Care Fund, ceases in 2020, we've got an £11.5 million cliff edge. And we don't know how we're going to deal with it yet.
How near are you not having the money to carry out your statutory duties?
We're not. It's very dear to my heart. We produce a balanced working budget and have done every year since we were responsible for the administration. Our internal audit says we deliver best value, we deliver good services. All of our kind of surveys of residents tells us that they welcome the level of service we deliver to them. It's the right service. We've had to make significant savings, £280-something million since 2010. A lot of money. 50% of our budget has gone. So inevitably that impacts on the services. But because of the way we've managed through our chief executive, I mean, you may have come across Pat Ritchie, excellent chief executive, through the leader of the council, Nick Forbes, through our section 151 officer, we've kind of worked as a team to put together transformational work in the council, looking at the way we deliver our services, trying to make efficiency savings where we can. We've lost 40-50% of our staff, you know, where our staff are struggling to deliver the level of services that is needed, you know, through demographic change in the city, through different needs, through people falling through the welfare net.
Yes, mine was not meeting those. I'm, you know, Veronica, I'm totally aware of that. But after all these efforts, how near are you to actually saying we've done all these cuts, we've done everything, but we can't meet any more our statutory duties? How near are you to that?
We've changed the level at which we deliver services so that they're only now delivered to people who are in critical need. So whereas before you would have been able to cover a much wider range of the population.
But if need goes up, Veronica, either one raises the threshold still further, or not just Newcastle, all of us who know what's going on in our local authorities will know that local authorities at some stage won't in any meaningful way be able to fulfil the statutory duties.
We haven't reached that stage, and we have a very limited amount of reserves, which is a minimum level according to our external you know, our external auditors and the independent chair of our audit committee. 10.1 million pounds. You know, we have other dedicated reserves that we use for transforming the way the council delivers services. Yeah. So we're not anywhere near the point at which we would fall over.
All right, great.
But I think there are a number of councils who are. Yeah. And that's a worry.
Back to you, Chris.
Okay, thanks. I think Sheila, Veronica's touched on a lot of this, but just to ask you, what are the barriers that local authorities face in maintaining a local safety net? And obviously, Highland Council was one of the first to have universal credit put upon it. So just to ask what the barriers are.
The challenges are very different between urban and rural, and the Highland Council area covers both. So we've got high concentrations of poverty and deprivation in our urban areas, in Inverness and Inner Firth, and the rest of Highland is more rural. It's more hidden in rural communities, so it's more difficult to tap into. Quite often you also find in rural communities there's not that word of mouth support. So there's not families speaking to families and saying, we got this, you might get this. So you don't have that measure available there. So what we do is we've looked at what is it we are responsible for and have influence over. What is it we can do within the council, and who else do we need to work with? And very much we need to work with partners. We cannot achieve this as a local authority on our own. So one of the things we look at is housing benefit, for example. Our speed of processing, we're best in Scotland for our speed of processing. Processing changes in circumstances, again, we're the best in Scotland. So those are the things where we've got control over and can influence. And there are other examples. But one of the barriers is, for example, the funding. So at the moment, DWP is funding the local authority to the level of 60%. The local authority is having to fund the other 40% to administer housing benefit. Now that 40% is money that could be spent on frontline services. Working with partners, you know, there's lots of faith groups in Highland and now delivering food. That's either hot meals or equivalent to the Trussell Trust, and we do have Trussell Trust in Highland. We do work with them very, very closely. Our local radio station, they fund food initiatives, community food initiatives. We've got an initiative about to start within the council to support local food initiatives. So there's a number of things that we're doing in Highland, but I have to say, as a local authority, we can't achieve it on our own. It very much is working much closer with partners than perhaps we did a number of years ago, and really pooling the local resource and ensuring that we deliver services where people are instead of expecting people to come to us. Public transport can be limited in Highland. It can also be very expensive. So we cannot expect people to come into local council offices or advice agency offices to access services. We need to take our services to these people. We also do lots of home visits in Highland, which can be resource intensive and expensive, but we feel it's really important to get that level of expertise and advice into people's homes so they do get the entitlements they are entitled to. Last year, we, within the Council's welfare team, we supported people to the value of £6 million. So that was the additional benefits that we got for people that they otherwise would not have received. And that's another £6 million in the local economy. So there's wins across. And that's what we're trying to achieve in Highland, is certainly looking at what are the fundamental things we can do at grassroots level to help individual families, but also to help the local economy, to try and attract more employment into the area so that more people can get employment. We're very reliant upon seasonal employment in Highland, and we're a low-wage economy. So that's something else we're looking at, is trying to lever in more professional employment opportunities in Highland.
Thank you, Sheila. I think you've started to cover what I was going to ask, actually. And actually, can I ask, how long did it take you to get here today, by the way?
We came yesterday.
All right, good. What are the things that I wouldn't... You know, I grew up in a rural community in West Yorkshire, but I dare say it's not on the level of rural nature that you are familiar with in the Highlands.
Yes.
What things would somebody who lives in central London or Manchester not appreciate about the extra challenges, people call it the rural premium, that people have that live in really, really rural areas? I know, Ruth, that's perhaps describing your constituency more than mine. I have rural poverty, of course I do, but the Highlands is quite a different landscape. Just list us out some of the things that perhaps we wouldn't have thought of that make life more difficult from a poverty point of view.
It's just sheer travel distances. So to get to a local job centre could be more than 2 bus journeys away. It could take you all day to attend your local job centre to see a work coach. From leaving the house in the morning to getting home at night, just because of the public transport provision. You've got your childcare commitments mixed in with all of that. Many families need a car to either get to work, to stay in employment. It's an essential in Highland. It's not a luxury. The other costs are access to services. To access services, you have to travel quite significant distances. So there's not always a local service where you can go to. And I think that's it. It's a sheer scale. The cost of living in Highland is more expensive in our rural parts of Highland than they are in our more urban areas.
Fuel is more expensive.
Because fuel is more expensive. Local shops haven't got that huge economies of scale. They don't have the range. And it's just everything is just more expensive in our rural community.
Okay. And where do you find the funding from? You're obviously turning the local authority model on its head and you're going out to people.
Yes.
How sustainable is your ability to fund that?
We're very fortunate within the council. I mean, obviously we've adopted the socio-economic duty because we have to in Scotland, and we've integrated that with our equality impact assessments. So when we're doing our EQIAs, we're also doing the socio-economic assessment as well. And we're very fortunate in that our elected members recognise just the sheer importance of welfare and how that impacts on health, on life opportunities, on educational attainment. It cuts across so many different responsibilities we have in the council. It's the bedrock, if you like, and we've taken that very seriously within Highland.
Thank you.
Ruth?
Thank you. And I mean, I'm in a rural constituency in the Peak District, but nothing like the distances that you've got in the Highlands. You didn't mention housing cost in your list. I don't know if it's an issue in the Highlands. It certainly is in a lot of rural areas. My area, probably Derek's, in the southwest, that there's quite a lot of second home ownership, and housing costs are very high, which means that people can't afford to do basic minimum wage level jobs on the housing costs. Is that an issue?
It is an issue in Highland, yes. We do have a very high level of second home ownership, as you say. We've also got a lot of people retired to Highland. So they've come from other areas where perhaps they've been able to accrue more savings, therefore they buy the houses in Highland. And it pushes up the whole cost in the private rented sector. We're very good as a council at building council houses, and our housing associations are also very good. So we do have a housing development programme for social housing, but private rented sector is very expensive, and we do pay a lot of discretionary housing payments to fill that shortfall between the LHA rate and the rent. We've got a budget in Highland of 1.7 million for our discretionary housing payment budget, and of course in Scotland we've got a duty to ensure that anybody affected by the social size criteria receives that payment from the discretionary housing payment. So we're trying to manage this £1.7 million budget to cover many things within that, so the benefit cap, many things. But yes, housing costs are a factor in Highland.
Okay, thank you. And Veronica, what do you think government could be doing more to help you as a council to tackle poverty?
Well, we've submitted, or about to submit, to the fair funding formula consultation. Right. And obviously, you know, councils just need more money. They're facing more and more demands. They're facing demographic changes in their population. I was just thinking, one of the things that I noticed, and I can't find my note about it, but we've had almost a 50% increase in the northeast, for example, and I'm talking broadly in the northeast there, not specifically Newcastle. In, for example, looked after children. Now that's the new cost pressure on councils. We've had increased duties placed on us, but no money to deliver them. So I suppose, you know, if anything, I would say in terms of the council, it just needs more money to do what it needs to do. But government can help some of that, can help stop or reduce the levels of deprivation and poverty and destitution in our communities. One of the things that really impacted on residents in the city, because we have quite a high level of social rented housing, social housing in the city, was the introduction of the social sector size criteria. I mean, we all call it the bedroom tax, you know, but it had a big impact on residents in the city. It's an unfair tax. We have got housing that was built in the 30s, 40s, 50s. Very, very little has been built since then, although we do have, like Sheila says, you know, we do have a housing investment programme, and our core strategy identifies that there will be another 30,000 homes built in the city up to 2030. But the houses we've got are the houses we've got. You know, and people have been in those houses for a long time. They don't want to leave them, you know, but it's causing pressure and causing some people to end up in destitution, in, you know, kind of really struggling to meet their costs. And that would be one of the things that I think government could look at.
Thank you. Yeah, can I just ask Sheila before we finish this session? You're obviously doing huge amounts as a rural council, and both of you as councils are going above and beyond. Are there reasons why other councils couldn't be doing this? I mean, for instance, I assume you're a unitary council, yes. And in most of England, then we've got split authorities are in rural areas. Would that prevent the sort of holistic approach that you've been doing in the Highlands?
I think as local authorities we're very good at sharing. We do share across our professional bodies, we do share between local authorities, so we are very good at looking at what has worked elsewhere and trying to import that in. Where it doesn't always work is the demographics can be very different, so local challenges can be very different. So it's not as easy as saying, so that's worked in Newcastle, so let's import it into Highland, or vice versa, because there are differences between local authorities. But I think we are very good at saying, they've done that well, let's go and learn about it and import it in. So we do already do that.
Okay, thank you.
Can I just ask you a last question? If there was one thing the government did which would relieve this relentless pressure on people and pushing into poverty and destitution, what would that one move be, please, Veronica?
For me, I think I'm trying to think of the correct terminology, but I'll just say what I think.
Yeah.
The cap on benefits has had a really regressive effect on people who are already struggling. And I think, I think we're moving towards the final year of that cap on benefits. It really should be stopped.
Great, very clear. Sheila?
I'm going to fudge this one. I don't think there's any one single thing that will crack this increase in poverty. I think there's a plethora of things that need to be done to actually drive down poverty. It's going in the wrong direction at the moment, and there's been a number of drivers to that. And yes, there are quite big chunky things you could do, but to do it properly, there's a range of things that needs to be done.
Very good. Thank you very, very much.
Pleasure.
And we'll see you
yes,
in
I
your
hope
home
so.
territory.
I
right?
hope so.
Thank you very much.
The proceeding is currently suspended.
By introducing yourself.
Yes, I'm Sally Weston. I'm Policy Manager at Age UK.
Michael, come on, let's get
I'm Michael Griffin. I'm the Senior Policy and Campaigns Advisor at Parkinson's UK.
I'm Fran Bennett. I wear various hats, but I'm here today as an active member of the Women's Budget Group.
I'm Elliot Kent. I'm here today as a member of the National Association of Welfare Rights Advisors, NARA. I am also, in my day job, I'm a benefits advisor at Shelter.
Steve?
Good morning. I wonder if you could tell me, what do you think are the main drivers of poverty, and how do they differ between the different groups that you represent?
I'll start. The main drivers of poverty for people with Parkinson's and other disabilities is actually living with a long-term health condition. So almost 50% of people in poverty live in households where someone does actually have a disability. So, for example, the cost of living with Parkinson's is £16,582 on average a year in the UK. And that is only going to increase the likelihood of living in poverty, that extra cost. These could be prescription charges if you're in working age, social care costs, alterations to homes, energy costs, and these are unavoidable costs that people cannot avoid. So the prevalence of Parkinson's is increasing by 23% over 10 years. So that's going to lead to more working age people living in poverty. The other side is the income. So you're less able to increase your income through work if you do have a disability. So the cuts to benefits do have quite a dramatic impact upon people's poverty levels. So for people with disabilities, increased costs, decreased income, which are the direct cost of living with a health condition, are the main drivers of poverty.
Yes, I guess for older people in general, whether you're in poverty on a low income in later life depends on what's happened in the rest of your life. So it's a kind of life course issue. So I was listening to your earlier witnesses. Clearly, if you've been struggling with debt, homelessness, sort of person that needs to go to food banks, then you're not going to be able to save for your retirement. You're struggling to meet your basic needs. So where people are unable to get a decent wage or they're unable to work at all for long periods of time, those are the kind of people that become our clients later on in life. In addition, I guess there are shocks that happen, income shocks. So if, say, in your 50s you get serious illness, you have to leave to care, divorce, bereavement, the kind of major life events that put any retirement plans that you've got completely sort of you have to abandon them. So things like that, it's very difficult to recover, particularly when something like that happens later on in life. And I guess the third thing, linking into what Michael's saying about costs. So if you are in later life and you have substantial kind of social care costs or disability costs or other kind of major costs, even though your income may look sort of reasonable or modest, those are the sort of things that put you into hardship and poverty.
I think many causes of poverty are similar for women and men, but not all. And in particular, some of the things which we miss if we look at household on poverty on a household basis, which we often do, is, for example, the unequal sharing within the household, which may indeed result in hidden poverty, particularly for some women, within a household which has an income as a whole above the poverty line. Or may hide the unequal sharing of the costs of caring, which quite often fall on women because they tend to be the shock absorbers of poverty within the family. I think also combining paid work and care is a struggle, and that particularly falls on lone parents, although not just lone parents. And, for example, the under 25 rate for lone parents is lower, and so that's even more of a struggle. But I think it's worth saying, in terms of, if you like, gender analysis of the situation, which is what the Women's Budget Group does, that it isn't necessarily just something to do with gender is not necessarily something that's just going to affect women, or indeed sometimes men, but it may be something which affects both. So, for example, in-work poverty, which is often talked about, if you talk about it as in-work poverty, it sounds as though the problem is the low wages of a breadwinner, or perhaps not enough in-work benefits. But actually, if you look at the situation, particularly for couples, quite often the problem is either that there isn't a second earner in that household, which is quite often something to do with gender issues, or that the second earner in that household is out of work but hasn't got an income themselves. So parental leave payments, for example, or the employment and support allowance for the work-related activity group, which has the contributory bit has now stopped after a year. So if you look at it just as in-work poverty, you might think it's an equal thing, but actually there are issues which are what we would say gendered, if you like, which would mean that you could do something about poverty for both men and women.
I suppose it might be quite helpful just to point out for the record that I've been given quite a specific brief today, which is relating to nationals from the European Economic Area and their experiences with the welfare safety net. What we find is that the experience in terms of the needs of this group is more or less similar to British nationals, Irish nationals and so on. But what we find as a unique experience and a particular driver of poverty in this group is they have a very precarious relationship with the benefit system, in that there are rules they have to meet in order to be able to make claims. And there are a lot of cases, and we've discussed some of them in our written evidence, where people from the European Economic Area are making claims for benefits and having extraordinary delays in actually getting their first payments. So I think that's probably, although there isn't necessarily a great deal of data on it, I think that's the unique experience of that group and the specific driver of poverty there.
Did we give you that brief, or did your group give you that brief?
I was invited on that brief, yes.
All right, very good. Steve?
Yes. Michael and Sally mentioned the notion of unavoidable costs, and the committee heard earlier from the Social Metrics Commission about their concept of inescapable costs in the poverty measure. How do you identify the unavoidable costs for the groups that you represent?
Well, I think that's it's a really important issue, but I think it is quite difficult to do. I think both of us in our client groups would be particularly interested in the measuring disability costs. And I think it's very welcome that the Social Metrics Commission is looking at that, and the recognition that poverty isn't just about the income that's coming in. As you say, it's the escapable costs. So I think it's a good start to do what the Social Metrics Commission has done. But if you look to them, what they do is ignore the value of the disability cost benefit, which, given the data, is a perfectly reasonable thing to do, because if you're given some money in order to cope with disability costs, you need to take the costs or ignore the income which they're doing. But it probably doesn't give the complete picture, because your costs may be higher than that, they may be different than that, you may not receive benefits. So, for example, if you're over state pension age, I should say now, you can't claim any help with mobility costs. So whatever your costs of mobility are, they won't be taken into account with the social metrics measure, because you haven't got a benefit to be disregarded. And the measure doesn't take into account social care costs. So sensibly it takes into case childcare costs, but your social care costs probably far exceed any attendance allowance you've got. So I think it's a good starting point, but we probably need to look in more detail about how we can look at those costs.
And I probably mirror what Sally does say. The inclusion of those unavoidable costs is a move in the right direction, but it is likely to undercount the costs of living with a disability. So going back to the figure, 16,582, that's about £300 a week that someone with Parkinson's would need to spend to live with the condition. Scope's Extra Cost Commission found a similar figure for people with physical conditions. Now, the same year that they did that study, 2015-16, the maximum amount you could get for personal independence payment was 140. So that's less than half of the actual cost that they found in their studies. So the way they calculate that by excluding those costs from the disability benefits is a difficult measure to use. It's a good start, but it is difficult, because if you're basing it on the government's payments, if the government cut PIP in half, you wouldn't see an increase in the levels of poverty, but we know in reality there would be an increase in levels of poverty. So what we would like to see is a regular independent survey to see and check what those extra costs of living with a disability are.
But that would be built ideally into the definition, shouldn't it?
It should.
In other words, it won't be dependent on you having a relevant benefit. It will be that you have a relevant need. And that may be offset by the benefits. But if you don't get the benefit, it won't be offset.
Exactly.
And therefore the extent of your poverty will grow accurately.
I think I still say that it will undercount. There are people who should get the benefit as well who don't get it.
What I'm saying is, when we are proposing changes, we've got there, as you've explained it, you're saying that your cost for disability only go into the new definition if you're getting a benefit to cover the disability.
Yeah.
Whereas the cost of disability remain whether you get benefit or not.
Yes.
And that's what needs to go in.
Yes.
Yeah. Sorry, Steve.
I was just going to say about childcare costs, which is particularly relevant to the group we're talking about, of course. And yes, we welcome the fact that Social Metrics Commission has proposed that. A lot of us have been suggesting that this should be included for some time in the measure of poverty. I think it's important to say measure rather than definition. It's the measure of poverty we're talking about. So it's a good thing. I think it will still understate the problem, as my colleagues have been saying about disability. That's partly because Donald Hirsch did a study which was trying to see how many more extra people would be in poverty if you did take account of childcare costs, and he found that the numbers were not enormous, but the reason he found that was because he thought people were avoiding paying for childcare where they possibly could, because they knew the negative impact on their income would lead them into poverty. So it's there may be a behavioural effect which you're not actually capturing by looking at childcare costs, but I think it's certainly a very good start, as my colleagues said, and I think it's particularly important because although we've got 85% covered under universal credit, that used to actually be 80% under tax credits before it was cut to 70%, which is not said very often. And the other thing is that the cap is on 2 children, of course, so more children don't attract more benefit, and also the ceilings have not been increased for some time. And therefore, actually, the amount of help you would get with childcare costs is not necessarily increasing with the costs. We do have quite a good account of the costs for childcare, of course, because it's not now called the Family and Childcare Trust, but it used to be. Does an annual survey of childcare costs.
Thank you.
Yes, it's certainly a very good point that Michael's made in respect of the cost of disability, not necessarily correlating exactly with personal independence payment or DLA. Very often people will have those costs and they won't be met by the benefit in that regard. So I think that's an important point. Other than that, I don't know that I'd have anything specific to add further to what everyone said.
Okay, thank you.
Very good. Derek?
Thank you. This is a bit of a challenge, but very briefly, can you each explain how your organisations have changed in recent years as welfare reform has, I'm going to say progressed, but you might not agree with the word progressed? So basically, your organisations, how has your work rate or the way you work and your engagement with people changed?
So for Parkinson's UK, what we have done is we have had to increase the provision of local advisors, people who can give advice and support to people to navigate the system as it has become more complex, and we now have some benefit and employment advisors who are more specialised to be able to provide that support.
Yeah, sure.
Yeah, we're not a support organisation in the same way. Women's Budget Group does gender analysis of budgets and spending reviews and specific policies. And the way in which I think it's changed us over the last few years is that we have done more analysis of specific policies. So I, in particular, have been working on universal credit since 2010, and a lot of the work that I've done on that has been anonymous, but it's been under the Women's Budget Group label. So we've found it essential to focus on specific policies because they are affecting the issues and the group about which we're concerned.
Elliot.
Certainly, NORA's represents a wide range of people, so there'll be different changes around the country, but in my experience it's been the case that there's been a lot more involvement in crisis work, there's been a lot more people approaching you with very, very low incomes that aren't going to get any better. There's, routinely referring people to food banks, which we wouldn't have done 5, 6, 7 years ago, and it's becoming a matter of routine. So I think in that sense there's a much greater level of urgency to people's problems, and there's a much greater impact on their lives, I think, from the cumulative changes that have affected people.
Sally?
Yes, well, from Age UK, we provide a lot of information and advice both nationally and through our local organisations. To some extent, kind of pensioner benefits have been sort of reasonably stable. We are now increasingly seeing people who are under what is now state pension age. So I think one of the things that we are having to do is, in a sense, expand the sort of support or the information and advice we give. We are starting to see more people coming for issues about universal credit, ESA, all the issues that the other organisations have been talking about, because pension age has been going up, and with it pension credit age. So people who are now in their early 60s, who a few years ago would be expected to be able to claim pension credit without all the sort of conditionality and the hoops for that. So we are starting to see people in those situations, and from May, unfortunately, it looks like we'll also see pensioners who are being drawn into the universal credit system through the changes to mixed-age couples. So I think that's something that we are starting to see. I think the other thing more generally on information and advice is pressures on local services. With local authority spending cuts, there's perhaps less information and advice locally, and that means the organisations that are there are sort of struggling to pick that up. So. And the other big issue that we get all the time is issues with the care system, and that's where we're having real difficulties in people accessing social care. So again, those are the kind of things that we've got to talk about.
I asked that because obviously we're talking about the welfare safety net, and we're just wondering whether you have a view on what the balance should be between central government, local government, and the voluntary sector, if you like. There's kind of a view, I believe, particularly I'm in West Cornwall, so Age UK are a fantastic, effective organisation, but there's a view that the voluntary sector are picking up more and more responsibility for stuff that previously would have been the state or the local authority. What do you think the balance should be? I don't know if it's an easy one to answer, but we've got this welfare safety net. Is it coordinated across the three, the government, the local authority and yourselves? And what should the balance be? Is that help? I mean, is that going to be? Who wants to tackle that? It's quite a challenge. Yeah, carry on, Fran.
Yes, it is quite a challenge. I think one of the important things to say is that in terms of the role of central government, it isn't just the welfare safety net, which I think of as very much the means-tested benefit last resort benefits, but actually non-means-tested benefits, which are at the moment providing a safety net, particularly for a lot of women. So, for example, they're living on their child benefit because of the universal credit 5-week wait, it's the monthly assessment, that's the issue. So they're living on child benefit, for example, or they're living on their carer's allowance, while something like the means-tested benefits are actually going wrong, or they're having to wait for them, and so on. So I think it's important to say that central government's role in maintaining those non-means-tested benefits is absolutely crucial. I do think local government is important, but in particular in terms of the local welfare assistance, which I know your previous report was about, I think what you called for there, actually, both the ring-fence funding and the minimum service standards for that is really important. I mean, I come from Oxfordshire, and there's an example of what's happened to local welfare assistance there, which I won't go into, but it proves the need for those things. And then I think support groups are clearly essential, partly to help people claim their rights from central and local government, partly to have a support group, which means that people with similar experiences can share that, and so they know they're not alone, and partly to help people with voice, if you like, to raise demands on the local and central government.
I would completely reflect what Fran said. Charities are there to provide support for people so that people can navigate through the system, but they should never be taking over these services. It will lead to different levels of service in different areas, and that again will be reflected in the balance between central and local government. Where we've seen, generally where we've seen a move towards local authority provision, there has been increased complexity and accessing support has become more difficult, and there's variation across the country, which has led to a postcode lottery of welfare service. The social fund is a great example. That was devolved to the local authorities. After a few years, the funding was withdrawn and the expense was put onto local authorities. And so now you've got a situation where some local authorities have an equivalent social fund in place, others don't have anything. So it's very, very much different depending on which area that you are. They were talking about localising attendance allowance, but when we pointed out the increased complexity and variation that would cause, they did withdraw that and not go ahead.
Yeah, great. Is there anything you want to say, Harry?
I agree with that, and I think as voluntary organisations, we like to be sort of seen as a kind of maybe independent and trusted organisation. People may come to us when they don't go to a central or local government. And then we can look beyond the presenting problem, which is what advice services do all the time. Somebody comes along and says, I can't pay my gas bill. We would kind of look at, well, are the benefits? Are you on the right tariffs? And then it perhaps comes up that they're struggling with finances because their husband's needing a lot of care at home. So it's that overview and helping get people to the right support and services and navigating the systems, as Michael said.
Elliot, is there anything you want to add?
No, I agree entirely with what everyone said. The voluntary sector, the local authorities, for the voluntary sector in particular, the role is more of a navigator rather than a provider of sort of essential services, really. And for local authorities, the concern is obviously that these costs that are being taken out of the national government very often one way or another falling on the local government, and there isn't necessarily the funding there to deal with that.
They're good. I mean, it's really important that we keep a very clear line between voluntary sector and what you do and not being part of the system. So I completely agree with that. So then finally, what policy, so in terms of striking this balance between the three and the role that you have, what policy changes are you looking for from central government that would help to really ensure people have a safety net and that you can do your work effectively?
So there's The thing that we would suggest is that they ensure that they do have the funding, as Fran said, it's ring-fenced and it does continue, it doesn't get cut at some future point, but also just maintaining national standards, that there is a clear, consistent guidelines that they need to follow and quality of service throughout the country, so you get the same service no matter where you are in the country.
Yeah, that's good. Fran, did you want to...
Sorry, I wasn't entirely sure what your question was about. Central government policies to maintain an effective safety net.
So you're the voluntary sector, if you like, or third group, whatever you want, third sector. What do you need from government policy to do your job and to ensure, actually, that, as Rich said, local authority government actually do have the policies in place to ensure this welfare safety net? What are you asking? What would you like to ask from government in terms of how they change, or what policy to introduce?
I suppose I'd say that I think the local welfare safety net is crucial, but can only do its job if the central government policies are the right ones to begin with. So some of the things that were actually asked of the previous people at the end of the panel, which was about what central government policies would be most important. And I wouldn't just say something like ending the benefit freeze, but I would also say I would want to say quite a lot about the structure of universal credit in order to help women in particular, and also in terms of the help to local government or support groups, I would want to say something about the funding of advice services, which maybe Elliot would want to say a bit more about, but I think that's also crucial, and that the funding is core funding for advice services and not just competitive bidding for project funding.
Yeah, that's certainly a good point in terms of funding of advice services. Obviously, legal aid for benefits was in large part lost all those years ago with LASPO. It would be good to see that return as part of the review. There are issues really in terms of the amount of money people have, which is driving demand on our services. I think one of the points that was made by Philip Stroud in respect of the work that the Social Metrics Commission has done is that the more money people have and the less cost they have, whether that's through work or benefits or whatever, the further away from poverty they move. And I think that would really take some of the pressure off our work if some of these initiatives that were mentioned in the first panel were brought into place. The benefit freeze, the 5-week wait, everything like that is driving demand on our services, and it's driving poverty.
I'm not sure I've got anything to add. Definitely support the information and advice, and the fact. Sorry, I said I didn't have anything to add in that aspect, but also the fact, as kind of Fran said, we can help central and local government services. We can be a sort of critical friend and feedback, and try to make sure that systems work as they should do.
Fran, given your work on universal credit and the financial position of women and children and maybe their safety, what are your conclusions? Does universal credit enhance their position and their safety or lessen it?
I think two issues there. One is their position, if you like, generally, and the other is their safety. And I know the committee has done a huge amount of work on domestic abuse, in particular in relation to universal credit. So their position, my own view is that putting all your eggs in one basket of universal credit, including the single payment, is taking away from people, and particularly women, because it's often women. In the research I did with Sirin Sung for the Gender Equality Network, it was often women in low to moderate income families who were doing the day-to-day budgeting, not necessarily paying the monthly bills, but doing the day-to-day budgeting. And if you have a single monthly payment with no hint about what this bit of the benefit is meant to be for, and with no pacing of the way in which you get the benefit over the month, I think if you're on a low income, and particularly if you're the household manager, that makes budgeting much more difficult. And I think in particular the whole month approach to changes of circumstances is going to make budgeting virtually impossible. So what I mean by that, there's been a lot of talk about the way in which pay periods don't fit in with assessment dates, but the whole month approach to changes of circumstances works either for you or against you, but it means that your circumstances on the day of the assessment date are what are taken as your circumstances for the whole of the previous month. If your baby is induced that day because you know this rule, then that's great because you get a whole month's extra benefit. If your 18-year-old flounces out, you absolutely get nothing for the previous month that you've been feeding her. And similarly, if you move house on the day before your assessment date, you're only given the housing costs that you're paying now if it's lower rather than the higher housing costs you were paying for the previous month. Now, I think that is going to be really difficult for people to manage, and it's not because they're bad managers. We know from research that most people on low incomes are actually very good managers. But you imagine if you're told to budget monthly and then the amount that you get has an arbitrary relationship to your needs depending on when those needs change relative to your assessment date. I just think that's going to be incredibly difficult.
I was also wanting to refer to the split payment issue.
Absolutely. So,
because, I mean, the problem with budgeting is huge. If somebody doesn't give you any money.
Absolutely, no. And I think the single payment also has implications for people's safety in abusive relationships, and also even for equality in non-abusive relationships, but where each of you getting some income would actually lead to a more equal relationship, which we also found in our research that we did with low-income families. And a separate payment, which was arranged from the beginning of universal credit, rather than a split payment by exception, I think would be more likely to be conducive to people's ongoing safety.
Great. Heidi?
So just to wrap up really, and I think most of you sat through the two earlier panels, and we've talked about people's views on weaknesses with the welfare safety net. Some of you just mentioned them just now: the structure of universal credit, 5-week wait, benefit freeze, housing allowance, general funding of local services. Just to kind of pull it all together for us, could you finish off, perhaps we'll start with Elliot and work down to Sally, with your thoughts on, do we still have an effective welfare safety net? And if we don't, I won't put those words into your mouths, you tell me, but if you believe we don't, the people that you work with, how does that affect them? Elliot?
I mean, I think there's... I don't know if I could say yes or no for the entire membership as to whether it's effective or not, but it's certainly less effective than when I started in this work.
And when was that?
About 7 years ago, I want to say. So it's less effective, as I say, in terms of people just routinely approaching us, not having the money they need to pay their essential costs. And that's not an exception. That's, every day you're coming across people. You sit down and you try and figure out if there's any more money they can get, and very often there isn't. And it's creating a different level of poverty, destitution, whatever terminology you want to use.
Elliot, what happens when you're going through helping somebody who literally are desperate and you find there's no extra benefit entitlement? What advice do you then give them?
That's a very good question. Often I don't have an answer. Often it's a case that someone's got insufficient money, they're having to make choices between paying for food or paying for heat. You can sometimes rely on the council, say, to provide 20 quid to stick on the meter. You can refer these people to food banks. Sometimes there's charitable support available, or there might be things like DHPs available, but in many cases there isn't a solution, and that,
was that so 7 years ago?
Sorry?
Was that so 7 years ago, Elliot, where you in fact have to say to people, well, sorry, I can't do anything?
I think there were some cases like that, but I think it's certainly more regular now than it ever was in terms of people coming in with that issue. Often it used to be the case that a lot of your work was finding some extra money that might be available to people. For example, getting the work-related activity group on ESA or something like that, but of course that's gone now, so you can't get that extra money. There's things like that
been boxed off.
Avenues have sort of been closed off. People affected by the benefit cap, often there isn't an answer to that, unless you can make them fall into one of the exceptions, which isn't always possible. You know, so that has become a much bigger part of certainly my experience. I can't speak for everyone, but definitely noticeably in my work.
Fran?
Thank you. I mean, I've said quite a lot just now, so just briefly, I don't think there's an effective welfare safety net, and I think a lot of women are affected by that, in particular partly because they're more likely to depend on the benefits, and partly themselves, and partly because they're more likely to get benefits for other people, and the mental anguish that I think people go through in terms of not being able to provide for their children is a particularly difficult situation. But I think also it's a bit sad that we're talking about the welfare safety net, to be absolutely honest. I mean, I've been working this about 4 times longer than my colleague Elliot here, and I would like to think that we're more ambitious than just having a welfare safety net, and that actually what we want to be doing is putting the security back into social security. I mean, if you've fallen off the trapeze, then you're already seen as a failure. You're already insecure, clearly, because you've lost your balance. So actually, I think we should be more ambitious, and we should be reconstructing a social security system which is providing real security, and actually is for, you know, all of us in it together, to coin a phrase.
Michael?
I agree with Fran and Elliot, especially Elliot's explanation of how things are getting more frequent. People are starting to get into these really sticky situations more often. But what I'd like to add to that is that the system has become so complex that its effectiveness does depend on your capability and experience. So for people who cannot navigate the system or can't find the help to navigate the system, it can actually push them into poverty. Getting the decision right for, say, personal independence payment is an example of one of the complexities. Mandatory consideration is just not fit for purpose. Tribunal hearings, the average is now 29 weeks until you get to a tribunal hearing, and some places it's over a year, and that's not an effective system. So, and then when you get to tribunal, 72% of decisions for people are overturned, and that's frankly an embarrassing level of bad decisions. That wasted resources on going through that appeal process could be better used to support people. I had a case recently of a lady with Parkinson's. She was receiving personal independence payment, she was reassessed, and it decided that she no longer met the criteria. With Parkinson's, you can never get better. Once you meet the criteria, you always meet the criteria. She was using the money to pay for her mortgage. So by removing that money and having to wait a year for tribunal, she was at risk of homelessness. Thankfully, our local advisors were able to help her, and we didn't need to go to tribunal. But that is an example of situations that people are increasingly finding themselves in. And I worry about the people who don't get the help and support. They're the ones who just, the welfare safety net is just not effective for them.
Yeah.
Thank you.
Sally?
Yes, I think the safety net works better for pensioners than it does for people under working age, because the benefit rates are higher. We haven't been subject to the same levels of freezing, and you don't have the same conditionality. I mean, there are clearly issues. There are lots of older people, you know, having financial difficulties. There are people who don't claim the benefits that they're entitled to. There are issues with the benefit system that mean people are living on lower incomes than they should do, combined with the extra costs we've already talked about. But I suppose at least most pensioners have a state pension, so if there's some reason you're not getting the pension credit, you should, at least you've got your state pension, which gives you some income. So where, looking back at some of the cases we had with our information line, there's some of the ones where the most difficult financial issues are those people who aren't yet pensioners, who are, as I said earlier, I think we're going to be seeing more, who are, you know, in their 60s, ill health, caring, struggling, and that's where, to me, it feels like we as an organisation are going to come across more of the sort of cases that other people are talking about, where people are having to try to live on very, very low levels of income. And I suppose my final point is that if we're looking at welfare more broadly, I suppose where we feel the safety net is failing most at the moment is the care system, where we're nearly 2 years since we were promised a green paper. We still don't know what's happening with social care, and people are really struggling managing.
Could I ask one final question to Sally, then I'm done, just specifically on pensions, because you are right to highlight, and rightly so, pensioners were significantly behind in terms of income. But now that that has been stabilised, the triple lock, should it still be a triple lock, or should it be a double lock? Inflation or cost of living? I think it's inflation, cost of living, or the arbitrary percentage. Is it time for that arbitrary percentage to go? Because it costs us, I think, $1.5 billion a year, something like that.
Well, in terms of, I know people talk a lot about hugely generous triple lock. In terms of what it makes individually, kind of year on year, it tends not to be very much for individuals. I was looking at, I think, this uprating, and it's probably a difference of 30p a week on your basic pension, whether they used which of the three measures. And I think one of the things that's important about the triple lock...
But collectively it costs an awful lot of money for the country.
Yes, in terms of... I mean, the social security budget is large. One of the things about the triple lock...
Sorry, Sally, if it's only 30p, it doesn't matter that much, does it?
Well, the point, I suppose, is going forward. And one of the things about the triple lock, yes, of course, it helps older people today.
Just because the top percentage, is it 3%? I forget now, it's a while since I've looked at this, but that arbitrary triple part of the lock means that it always, or it has for years now, outstripped and been much higher than inflation. Or is it cost of living or wage rise? I forget the other lock on.
Yes, it depends which one.
Yeah.
And
so it has outstripped everybody else's income. And don't get me wrong, we needed it. My question is, you know, the government will say, well, find me the money, Heidi, if you want to spend all this money on welfare. But should we, if it is, as Frank says, only making 30 pence a week, but collectively would give us a much bigger pot to put back into other areas of UC, for example, should we be looking at that?
Well, I think what we also need to look at is not just current pensions, but future pensions. Because if you look at, for example, the work of the Pension Policy Institute, the biggest impact of the triple lock is for lower income, poorer people going forward. So younger people who may not have much opportunity to build up private savings, but if they can build up a little bit, the longer that the triple lock is retained, the more likely it is that sort of lower income current workers will be able to avoid poverty going forward. So I think it's probably not so simple as just saying, you know,
but we also have auto-enrolment now, which we didn't have before. So people, if they are still working, will also be gaining more of a pension there as well.
Yes, and the kind of two, I think, work very well together for the lower income groups. I mean, I can certainly send you the details of the Pension Policy Institute report, which is quite useful. But I think it needs to be a careful analysis of not only what it might bring in the immediate, but the impact it would have for current and for future pensioners.
Very good. We're going to end there. Thank you very much, all of you, for your evidence.